we're going to go through the arteries. Here we have the heart, and this would be the arch of the aorta. We have two arteries here. The larger one is the brachiocephalic artery, and then we have the left subclavian artery. So the brachiocephalic artery, left subclavian artery. The brachiocephalic artery here branches into three arteries. It's kind of hard to see. 1, 2, 3. The first one is the left common carotid artery. The second one is the right common carotid artery. And then the third one is going to be the right subclavian artery, which goes out into the arm. In the axillary area, it's going to be called the right axillary artery, and then it'll transition into the right brachial artery. It's kind of hard to see on this cat. You can see on the left side. So this would be the left axillary artery, and then the left brachial artery. Okay, and then we have the heart. Superior to the diaphragm would be the thoracic aorta. We can just keep following that down. Once we pass the diaphragm, it's going to be known as the abdominal aorta. The first branch we have is going to be the celiac artery, which goes into the hepatic, gastric, and splenic arteries, which are kind of difficult to see on here, or at least I can't identify them. The next one we see is going to be the superior mesenteric artery. And then again from the aorta, we have this will be the left renal artery. It's connected to the kidneys. We keep following it down. And we have the inferior mesenteric artery. And then this will be the left iliolumbar artery right next to the iliolumbar vein. And then we have two branches here. This is the left external iliac artery and the right external iliac artery. And the second branch is the left internal iliac artery and the right internal iliac artery. And then we can't see it too well, but down here is the caudal artery. So if we follow the external iliac artery, this is the left external iliac artery. We'll find the femoral artery. And then once we get to the popliteal region, it'll be considered this will be the left popliteal artery. Is that all of them? Mm-hmm. Anything?
Right here we have the superior vena cava. It branches off into the right and left brachiocephalic veins. This right here is the right external jugular vein. And then right here is the left external jugular vein, but it's kind of out a little too far. And then right here where it starts to branch, it's called the left subclavian vein. It branches off into, the top branch would be the left subscapular vein. And then this branching right here is the left axillary vein, and it goes right into the left brachial vein. And then down at the bottom of the cat, we have the inferior vena cava, which a little bit farther branches off into the left renal vein. And then right down here, we have the left iliolumbar vein. And if you look in here closely, you can see the branching from the left and the right common vein. And this is the left common iliac vein. It goes right into the left external iliac vein. So if you follow the left external iliac vein all the way down to where it starts to branch, this branching right up here is the left femoral vein, and it goes up into the left popliteal vein. And then the other branching is the left saphenous vein.